Hi, drains. A drain is a tube that is inserted in a wound or a body cavity to allow the removal of fluids and gases. So this broad definition covers so many catheters or tubes that are inserted in wounds or body cavities to help drain a body fluid. Example, an NG tube is a drain. A urinary catheter is a drain. A nephrostomy tube is a drain. A pigtail catheter is a drain. The catheter used for VP shunts is a drain. So by definition, all these are technically drains. So that leaves a very wide range of types of drains, but I'm going to center on the most common surgical drains you encounter when you practice. But first, let's cover the uses of drains. The first thing is, from the definition, it helps to drain body fluids, gases, inflammatory products, debris, pus, and all that from the body or wound. Then another use is that it relieves swelling and pain. Another use is that it helps to eliminate dead space in a wound or a body cavity, depending on where it's being used. Now, types of drains, there are different types, like I said, but for simplicity, there are two broad types: the passive drain and the active drain. The passive drain depends on gravity to drain fluid and gas. Depends on gravity, depends on body movement and positioning, and differences in pressure gradient. So that's what it depends on to drain fluids or gases from wherever it is inserted. An example of passive drain is a Penrose drain. You see it in most surgeries, especially chest surgeries, abdominal surgeries. You will see that it is inserted, just like you see it in the picture. It is inserted and it drains whatever into the dressing that is around that wound site or surgery site. So that's it for the Penrose drain. Now, active drains. Active drains, they are closed system. The passive drains are open system, so they are not connected to any unit. They are not covered per se, but the closed drains or the active drains are connected to a system which is sealed, so it's not open to air. Let's just put it that way. So the closed drain, they use an artificial pressure gradient. You can use suction, for example, and it can use some kind of mechanically induced negative pressure. I will explain as we go on to the examples, to help drain the fluid from the body cavity or the wound. So that's the difference between active drains and passive drains. The active drains, of course, are more useful because they do the work. They drain the fluid more quickly, so the fluid does not sit in there and be a source of infection. Now, it can be connected to suction, and it could be continuous or intermittent, or you can use your hand to produce a negative pressure in the drain, so that negative pressure helps to pull the fluid into the bag or into the drainage unit or whatever it is that is being used there. So an example is the JP drain. The JP drain is not connected to suction, but it uses negative pressure. So what you do is, it has two ports. One port is connected to the JP drain itself, the bulb Then another pot is also it. So it has the one pot is for drainage, the other pot is for emptying the bag or the the bulb. So when you empty it, you squeeze it before you cover the pot. So that's pressure you give it will create a negative pressure in the bulb, so that it will now pull the fluids. When the negative pressure is gone, the bulb will go back to its original size. So you can then open it, empty it, and squeeze it again to create that negative pressure. So that's for JP drains. And the Hemovac is another type of drain that uses the same idea with the JP drain, but this time, just like you see it in the picture, it is squeezed. You squeeze the whole unit, it becomes squeezed. So that pressure is, a negative pressure is created inside. So when you attach it to the tubing that it's connected to the surgical side, it drains it by negative pressure. So that is the Hemovac. Then there is the chest tubes. Chest tubes are also drains. Those ones are specialized drains, but they are also drains. So chest tube may be connected to a wall suction, and then the suction will help. There's also the chest tube unit also has its own suction control to help pull the fluids from the pleural space and into the drainage system of the chest tube. So that's the one that uses suction. There are other ones too. There are so many of them. I'm just focusing on the most common ones. But then I also want to talk about a special kind of drain that is used for negative pressure wound therapy. So what happens is that, just like you see in the picture, a tubing is connected to this unit that helps to pull fluid inside the unit. So unlike other drains, this drain is special because other drains you have to cover if it's a surgical site, you have to cover it before you put the drain. But this one, you leave the wound open. They use it for wound. You leave the wound, you don't cover the wound. By that I mean you don't make an incision to cover it. Rather, you leave the wound open, you put a dressing on it, and then you attach the tubing from that wound vac system, put it on there, and then it will suck up all the inflammatory products, all the fluid there and everything. There are even some of them that help to rinse it out. So they will send water in and rinse it out so that the wound, and it's very effective and in wound healing. So that is the wound vac, or the negative pressure wound therapy. It is also a drain. So I'm going to stop here. Oh, well, before I stop, let me talk about nursing implications. Nursing implication is that you assess the wound site or the surgery site for infection, redness, swelling, pain, and then there are some of the drains that have orders for you to flush. So sometimes they say flush Q6 or every shift or whatever, whenever, according to the order, you flush it. And then you also you monitor I's and O's, of course, and document it. And then for the ones that are attached to suction, make sure you know if it is intermittent or continuous suction, so you do what is appropriate for that wound. Thanks for listening. Make sure to like, share, subscribe, and follow for more.